Harold, we have a federal warrant related to billing fraud and audit destruction across the health system's 14 hospitals.
Harold Van Ostrand was the final word on billing compliance across 14 hospitals. Investigators say he personally destroyed the audit findings meant to catch a billion-dollar fraud scheme he was directing.
I think it's important to understand the broader financial pressures the organization was navigating. This wasn't a decision made in isolation.
He would not get the chance to order one more compliance file cleaned up before a newly hired auditor discovered that patient records she had personally flagged for genuine coding discrepancies had been quietly replaced with fabricated versions she had never created. Within weeks, investigators would trace 9 years across all 14 hospitals in the network, an estimated $1.3 billion in fraudulent Medicare and Medicaid billing, and the deliberate, systematic destruction of audit records tied to at least 340 separate flagged billing reviews. A forensic review of the document management system would find every single one of those destroyed originals still recoverable underneath their fabricated replacements, each edit traced directly to logins under Van Ostrand's own compliance division. Internal emails would show him personally instructing staff to clean up specific files before a federal review window, in his own words, on his own account. Upcoding directives themselves had reportedly never been put in writing at all, delivered verbally in staff meetings specifically to avoid leaving any trace. One newly hired auditor's refusal to accept that her own flagged findings had simply disappeared, and her decision to report the alteration directly to the board rather than back through the chain of command that led straight to Van Ostrand, was the only reason any of it came apart. What began as one upcoded claim would end with a federal courtroom hearing exactly how a hospital system's chief financial officer had spent 9 years turning the exact compliance infrastructure meant to catch billing fraud into the mechanism actively concealing it. I need you to sit with this one for a second before we keep going. $1.3 billion, 9 years, 14 hospitals, and it took a brand new auditor refusing to accept a disappeared file to finally stop it. If that gets to you as much as it gets to me, say so in the comments and subscribe. These stories matter. Harold Dean Van Ostrand was born in 1963 in Cincinnati, Ohio, and pursued a career in healthcare finance directly after earning an accounting degree in 1985, spending nearly 2 decades working his way up through hospital finance departments before being named Chief Financial Officer of Meridian Regional Health System in 2002. At 39 years old, a role that gave him final authority over the system's billing compliance division and made him the system's designated point of contact for any federal billing compliance inquiry. Colleagues from his earlier finance career recalled him as exceptionally fluent in institutional language, someone who could reliably reframe difficult financial news in terms the board found reassuring. He built a genuine reputation over his first 13 years as CFO for disciplined financial management, guiding the health system through several difficult periods of reimbursement pressure and cost growth that affected hospital systems broadly during that stretch. A track record that earned him considerable trust and autonomy from the health system's board. A 2013 trade publication profile specifically praised his steady hand through a period of significant industry-wide financial turbulence. Around 2015, Meridian Regional Health System faced mounting financial pressure as reimbursement rates tightened, and the system's 14 hospital network struggled to meet growth targets the board had set following a series of facility expansions. Pressure that fell most directly on Van Ostrand's own performance evaluations and compensation structure as Chief Financial Officer. Therefore, in 2015, 13 years into a role built entirely on the health system's trust in his financial and compliance leadership, Harold Van Ostrand began directing a system-wide upcoding scheme, instructing billing staff to code procedures and inpatient stays at higher acuity levels than patients had actually received, a decision that expanded considerably in scope over the following 9 years as the practice was rolled out across all 14 hospitals in the network. Federal healthcare billing compliance depends on internal audit processes that hospital systems are legally required to conduct and honestly report, a structure that assumes an executive with final sign-off authority over compliance findings is acting as a genuine check on the system's own billing practices rather than the person actively directing those practices to begin with. That assumption, reasonable for the overwhelming majority of healthcare executives in Van Ostren's position, created a specific structural vulnerability once he personally began directing the exact fraud his compliance role was supposed to catch, since his sign-off authority over internal audits meant no meaningful internal check existed above him within the health system itself. Federal regulators and the system's outside auditors relied heavily on the health system's own internal audit working papers as the primary documentation of compliance review, a reliance that assumed those working papers accurately reflected whatever compliance staff had actually found during their review, rather than assuming any possibility that findings might be altered or destroyed before ever reaching outside review. That system, built on the reasonable premise that an executive holding final compliance authority would use it to protect the system's actual regulatory compliance rather than to actively conceal violations, worked exactly as intended for 13 years of Van Ostren's tenure. It also meant that once he decided to begin directing the upcoding scheme, the exact final authority and outside auditor trust that made him effective as CFO became the precise mechanism letting him direct and conceal it for 9 additional years across an entire 14-hospital network before a single systematic review from outside his own control caught the pattern. Van Ostren's method, once investigators reconstructed it, relied on directing upcoding practices verbally in staff meetings specifically to avoid creating any written directive, a deliberate choice that left compliance staff and coding supervisors executing the practice without any documented instruction tracing back to him personally. When internal compliance staff flagged genuine billing discrepancies during routine audits, discrepancies that, properly reported, would have exposed the upcoding pattern, Van Ostren ordered the health system's internal compliance division to alter or destroy the resulting audit working papers before they could be reviewed by federal regulators or the system's own outside auditors, replacing them with fabricated versions showing clean compliance results. He cultivated what 3 former compliance officers would later describe as a genuine culture of fear around raising billing discrepancies, with one officer specifically recalling being told her position might not be sustainable after raising early concerns years before the scheme was ultimately exposed. An environment that discouraged internal reporting well beyond whatever formal compliance. Procedures technically existed on paper. Over 9 years, the scheme affected the full 14-hospital network, generating an estimated $1.3 billion in fraudulent billing, with internal compliance staff eventually documenting the destruction of audit records related to at least 340 separate flagged billing reviews across the scheme's full duration. In January 2024, a newly hired internal compliance auditor, assigned to reconcile a routine sample of billing records against patient charts ahead of a scheduled federal audit, discovered that several patient files she had personally reviewed and flagged the previous month for genuine coding discrepancies had, weeks later, been replaced in the system's records with entirely different, corrected versions she had never created or approved. Genuinely unable to reconcile what she was seeing with any legitimate explanation, she made the deliberate decision to report the alteration directly to the health system's board audit committee rather than back through her own compliance chain of command. A chain that, she understood, led directly to Van Ostren himself. The board audit committee, taking her report seriously given its specificity, authorized an independent forensic review of the health system's document management system rather than referring the matter back through normal compliance channels. That forensic review found something Van Ostren and his compliance staff had apparently never realized. The document management system retained a permanent version log even after files were replaced, meaning the original flagged audit findings remained fully recoverable underneath every single fabricated replacement. Across all 340 identified instances of altered or destroyed audit records, investigators found the recovered originals and traced every single edit directly to logins under Van Ostrand's own compliance division, establishing a documented, systematic pattern rather than any isolated incident. Investigators subpoenaed Van Ostrand's internal emails and recovered explicit instructions to compliance staff to clean up specific audit files before a federal review window, language that, combined with the recovered original documents, removed any ambiguity about the deliberate, personally directed nature of the concealment. 3 former compliance officers, once formally interviewed, independently described the culture of fear Van Ostrand had cultivated around raising billing discrepancies, testimony that established the concealment as a sustained institutional practice rather than any single moment of poor judgment. A hospital coding supervisor, coming forward as a whistleblower, confirmed that upcoding directives had been communicated verbally in staff meetings specifically to avoid creating any written record, testimony that closed the gap between the recovered audit evidence and the underlying upcoding practice itself. The smoking gun was the combination of the recoverable version log and Van Ostrand's own cleanup emails together. 340 separate instances of genuine audit findings preserved underneath fabricated replacements, all traced to his division, and his own written instructions establishing exactly why those replacements had been created. On April 9, 2024, at 9:00 in the morning, FBI Cincinnati Field Office agents and U.S. Department of Health and Human Services Office of Inspector General investigators approached Van Ostrand at Meridian Regional Health System's Cincinnati headquarters as he reviewed quarterly financial reports. "Harold, we have a federal warrant related to billing fraud and audit destruction across the health system's 14 hospitals," the lead agent said. Van Ostrand set down a report, his composure remaining notably measured, almost corporate, his response framed in institutional rather than personal terms. "I think it's important to understand the broader financial pressures the organization was navigating during this period. Healthcare systems across the country faced similar reimbursement challenges. This wasn't a decision made in isolation. We have 340 recovered original audit findings, Harold, all traced to logins under your division and your own emails instructing staff to destroy them." His measured, institutional framing held for a moment longer, though something in it began to strain. The organization made decisions under considerable financial pressure that in retrospect crossed clear compliance lines. I take that seriously. You personally directed the concealment, Harold, not the organization. You, for the first time, the corporate distance in his voice fully gave way, something smaller and more exposed emerging in its place. I don't know how to talk about this without the language I've used my entire career, he said quietly. I've spent 40 years describing decisions in terms of the system, the organization. I'm having genuine difficulty finding the words to describe what I actually did. $1.3 billion. Harold, 9 years. 14 hospitals. He said nothing further for a long moment, his hands, which had gestured with practiced executive composure throughout, going completely still. I want my attorney, he said finally, his voice carrying none of the institutional distance it had held only minutes earlier. He was placed in handcuffs in the same headquarters office where, for 22 years, the health system's board and federal regulators alike had trusted him as the final word on the system's own honest financial and compliance reporting. At 9:09 that morning, several finance staff frozen near the doorway of the executive suite. The sentencing includes the prosecutor's exact response to him hiding behind the word organization. Stay for that part, and subscribe if you want more of these every week. Federal prosecutors in the Southern District of Ohio charged Van Ostrand with healthcare fraud, obstruction of a federal audit, conspiracy, and destruction of records in a federal investigation. Specifically addressed the scale involved, noting that 14 hospitals and 9 years represented not a single lapse, but a sustained, deliberately concealed institutional practice that had, by design, been built to survive exactly the kind of external scrutiny it ultimately failed to survive only by chance. Following the case, The U.S. Department of Health and Human Services Office of Inspector General implemented expanded federal audit requirements, mandating independent, externally hosted document management systems for compliance records at any health system above a certain size threshold. Specifically removing the internal alteration capability Van Ostrin had spent 9 years relying on, and closing the exact internal control gap his final compliance authority had let him quietly exploit. He spent the entire confrontation talking about the organization. The prosecutor's reply was simple. Organizations don't destroy evidence. People do. The case waiting on the right-hand side runs on that same institutional distance.